Good morning, everyone, and thanks so much for joining this webinar talking about integrated youth services, youth hubs in Canada. This is part of a broader initiative called Breaking the Silence, which started approximately 6 years ago when a group of friends lost one of their best friends to suicide. And at the time, these friends had no knowledge or understanding of mental health whatsoever, and they were at a loss for trying to figure out why this friend of theirs, who was the best athlete, the best looking, the funniest, who seemed to have everything in his life that one could possibly want, could do something like that. And so they were at an inflection point in their lives where they could have said, why us? Why did this happen? But what they did instead was they set upon a journey to first understand, what mental health and what mental illness is. And then they wanted to share that knowledge with their broader community. And so they started Breaking the Silence, which for the first 5 years was a walk run held in Edmonton, Alberta. And this year, we were brought on as a foundation to just kind of help support and bring together a bunch of different stakeholders, really to try to create an ecosystem of people that want to talk about mental health and want to improve mental health care, both locally, provincially, and nationally. And so we've been really fortunate to have partnered with 5 other organizations in the province of Alberta, and also really blessed to have experts both nationally and I would argue internationally talk about really germane topics around mental health. And today's session is no exception. I know Pam very well. She's a close personal friend of mine, and Joanna, I've had the good fortune of meeting once or twice, but to my mind, they're some of the leaders in the country in the area of integrated youth services and have very unique perspectives based on both where they exist in the country, but Pam, especially given that she's done this work now in 2 jurisdictions, 2 provinces in the country, and I think offers a unique perspective in that regard. So I'll hand it over now to Pam and Joanna, and I'm going to turn my camera off and shut up because my wife says I use 18 words when 4 would suffice. So I'll do that now and hand it over to Pam and Joanna. And thank you guys so much for doing this. I really appreciate it.
Our pleasure.
Thank you for the intro.
Sorry, Joanna. So just quickly, Mark, I think we're going to start with just a quick poll, not knowing exactly what information folks have about integrated youth services. So we've got a bit of a deck, just a high-level introduction to integrated youth services. Joanna and I are going to tag team on that. And then I think Joanna's initiative, the Youth Wellness Hub Ontario, is quite a bit further along than the work here in Alberta. And so Joanna's then going to talk a little bit about specifically to Ontario. And then I can talk a little bit about my experience in British Columbia through Foundry.
So thank you very much, everyone, for the opportunity to be here today. And thank you so much for your interest in this particular area of work. I think Pam and I thought we'd share a bit of information, core information for you to sort of set the stage, and then leave lots of time for discussion, conversation, questions, so that we really are able to give you what you need and want out of this discussion today. So overview, going to give you a bit of the current context, the need for integrated youth services. We're going to talk about the model itself, the vision and objectives of the model, how our provincial and community-based partnerships work, the critical importance of youth and family engagement, and certainly one of the unique features of this particular model of service delivery, and early transformation in the Canadian context. So why do we care about youth mental health? Why do we consider this to be something that requires a national system transformation, if not global system transformation effort? If we look at the disease burden across ages, you can observe many different things on this particular slide. But of course, what I'll draw your attention to is when you look in that mid-teens to mid-20s age range, and you look at that orange peak that you see, that reflects the burden of mental disorders in this particular age range. And relative to any other time in life, you see that mental health is a particularly burdensome challenge for the adolescents and young adults that we work with. And I think across all of the initiatives that are happening in Canada, we're really thinking across those age ranges. So, and we typically use youth as the word to describe this. This really is sort of 10 to 25 age range. Sometimes people will define that up to 29, but you're really thinking about that adolescence and into early adulthood. If we look at ages of onset, and and think in terms of mental health and substance use, the vast majority of both begin prior to age 24. And so we're really missing the opportunity to intervene, both from a return on investment perspective and of course of critical importance, quality of life. And so what you can see here is really a different way of thinking about the cost of our failure to act in to address mental health and substance use concerns amongst those who are in the 10 to 29 age range. Sadly, despite the burden and challenge and the prevalence and the unique sort of risk that this age range brings for young people, service utilization is notoriously poor. And you'll see by looking at this graph, so the green, the kind of lighter green bars versus teal show that where we have the highest prevalence, we have the lowest engagement in service. And so you really see that mismatch. Now why do we have, and one of the things that's particularly unfortunate is that we actually have effective treatments for many mental health concerns, but young people are not receiving those services. And so the question becomes, why are they not receiving those services? And I think for a long time, there was a prevailing view that teens are teens, and it'll pass, it's just a phase. I think there was a sense that teens are generally resistant to services, and so the problem resides in young people. But in fact, as we've started to do a lot of this work, what we found is that when we actually think from a different perspective and think about what can we do as a system to close this gap, both from starting right back at research and how we develop our treatments and our models of service delivery, through to how we actually implement on the ground, if we start from the perspective of engaging with young people, thinking about what do they need, we can actually start to close this gap much more effectively. I know you're starting at slide 9, Pam, but I can't see the slide numbers. So just so you know, so where are we at, when we think about youth and youth mental health? One of the things, and why are youth uniquely at risk for mental health and substance use concerns at this time in their life? And really, so many different things are happening. Biologically, young people's brains and bodies are changing in really significant ways, but also from a psychosocial perspective, where young people are experiencing some of the most challenging transitions they'll experience in life, being nested in a family to, for many young people, but not all, there are definitely cultural differences, but for many young people, that transition to autonomous functioning, a transition away from family being your core group to intimate relationships and strong social connections as being the thing that'll carry you through difficult times when you're away from home, transitioning around employment and education, and really starting to think not just about today and next month and next year, but in fact 10 years out, where do you want to be? And these developmental milestones and developmental tasks really create a lot of challenge for young people as they navigate through this time. In addition to that, likely in part related to those challenges and brain-based challenges, we see these peak rates of onset for mental health and substance use concern. And right at that moment, our system is weakest, and in most jurisdictions, we've inserted this mandatory transition in our healthcare and our mental health care at the age of 18. So we move from a system of care that's been very supportive in a lot of contexts, has a focus on development, thinks about young people from the lens of young people, to an adult-based system that functions very, very differently. So right when young people need the most support, we pull away the system that could be most helpful, and in place, in some jurisdictions, don't put any system at all, and in other jurisdictions, put a very sort of loose range of services that are really quite skewed towards much more serious mental illness, leaving many young people without the supports they need for optimal development. So how do integrated youth services respond? They respond by really thinking about young people holistically. So really thinking about young people not through the lens of mental health or substance use or education, but in fact thinking about a young person as embodying all different aspects of themselves, all different aspects of identity, and all different developmental tasks. And this, many of you in the room may be involved in service delivery, and you'll know from your experience, young people don't come in and say, I think I'm experiencing difficulties with depression. They come in and they say, that's it, I'm not going to school anymore. I'm done. Everyone hates me at school. I'm totally overwhelmed. I'm freaking out. I can't do it anymore. And our job as a system is to start to sort of understand what are the contributing factors and how do we best meet their needs. Historically, our system is divided into silos for each of these different areas, but instead now with our integrated youth services movements that are happening across Canada, we're arguing that we need a one-stop shop model of care. We need to bring together all of these relevant services and domains of work into a one-stop shop model of care, so a young person can walk in the door and they can say, that's it, I'm done. And we as a system figure out amongst all of our services that are working together how to build the best service plan for a young person. So key features are a focus on young people aged 12 to 25. So it spans that mandatory, gets rid of that mandatory transition at age 18. It integrates a variety of different services into a one-stop shop model of care. These services are provided in youth-friendly locations. So if you talk to young people about what it feels like to walk into, I sit in a psychiatric hospital. I'm at CAMH, Center for Addiction and Mental Health in Toronto. What it feels like to walk into a psychiatric hospital to address the kinds of concerns we're talking about. It's not a youth-friendly location, so thinking about youth-friendly locations, really thinking through the lens of youth co-creation, so that youth are participating in design of all aspects of service, that the services are embedded and integrated with the broader community where young people are, so community and school, and have a high degree of visibility so that people know where to go when they need support, and that the services are constructed in a way that they have broad reach across different kinds of identities, different kinds of geographic contexts, and different kinds of sort of cultural contexts that exist in Canada. I'm going to turn it over to Pam now, who's going to carry on.
Sure. Thanks, Joanna. So I think another interesting aspect of integrated youth services is that typically they are organized through a steps model of care. And I'll talk a little bit about this in a soon to be displayed slide. But essentially, there's partners, a significant number of partners from different organizations working at any given time within the physical center. And so the idea on the step care model is to provide the right intensity of service to meet the need of that young person when they need it. And this is a way of sort of helping to organize all the partners across the step care model to identify for themselves where they kind of fit in this model. And typically at the step 4, which is the highest intensity, that's when oftentimes warm handoffs are provided to other more intensive acute-based services, but there are some level 4 services happening in the centers as well. So I'm just going to skip over this one, Joanna. Thanks. So this slide really just meant to give you guys a sense of what's happening in terms of the integrated youth services momentum or movement nationally. So you can see that, you know, in Ontario, where Joanna's from and where Joanna is, there is the Youth Wellness Hubs Ontario initiative that she's leading. There are also a couple of Access Open Minds centers that are joining the Youth Wellness Hubs Ontario network as well. So Access Open Minds, you see that those light green dots are kind of scattered across the country. A pretty significant proportion of those centers are located in First Nations or Inuit communities. And it started as a research project, really funded through CAMH and the Graham Beck Foundation. There's two here in Edmonton, one downtown and one at the University of Alberta. And again, of course, we're having conversations about those transitioning into the larger Alberta Integrated Youth Services Initiative. If you look at British Columbia there, those are Foundry centers. They, just last week, there was a public announcement, a media event where the ministry and Foundry announced an additional number of communities to join the Foundry network. So they are moving quick and fast. But you see that really in almost every jurisdiction in Canada now, there is interesting work happening around integrated youth services. So why that's important and helpful, I think, is that there's definitely recognition that this is a model to implement, but also we're able to work together in pretty cohesive ways to share learnings, share knowledge, share models, share all of it, including data and evaluations. Thanks, Joanna. So really, you know, the broad, and this would vary by jurisdiction in terms of the communities and the partners who would be a part of developing the vision for integrated youth services. But, you know, just based on what Joanna was saying earlier, this really is meant to transform access to care for young people and their families or caregivers. We're not talking about tinkering around the edges. We've been doing that for many, many years, and we're still struggling with significant wait lists and inability to get the access to care. Typically, the reason is that there are no, or there's a lack of needed accessible community-based access points that young people can just walk through the door. So that's the broad vision here. So as I'm in Alberta, and many of you are as well, just very quickly, you know, this initiative here in Alberta is funded through significant support from philanthropy, including the Mental Health Foundation, Graham Beck Foundation, Stollery Children's Hospital Foundation, RBC, and Bell. And this just gives you a high-level sense of what our 3-year demonstration project is meaning to do. So of course, we're looking to work with Alberta communities to establish the centers. We are also looking to, and COVID has obviously shifted all of us in terms of the work that we do and how we're doing that. But always part of this model was to include some other non-traditional access points, including web-based services. We know that often young people prefer, at least in the initial stages anyway, to access services virtually. I am leading a provincial implementation and coordination team, and I'll talk a little bit about that. And importantly, you know, as this is a demonstration project, we are building out a robust and comprehensive evaluation framework, really, you know, demonstrating the impact, not just at an individual health outcome level, but also at a community level in terms of how people are working differently together. So quickly, if folks are aware of collective impact, essentially they're, you know, again, in terms of transformation, this is not something that's going to be achieved off the side of folks' desks. We know that. So there is effort needed to, from a provincial perspective, to really support communities in understanding how to do this work. So this is done in partnership with communities. It's not done, you know, to communities, and it will look different in different communities. Of course, we know that communities are different. They've got slightly different needs, but essentially there is a core model that people are supported with. And I think some of the value proposition of being part of a larger network, of course, is that, again, as with the national scene, people are not needing to reinvent the wheel on everything all the time. So there's learning, you know, there's different organizations who are part of it, which serve to bring really interesting innovations and creativity that can then be shared across the network. So knowledge mobilization, you'll see that there, is a pretty important piece. Of course, research and evaluation, the actual service development, and just supporting those partnerships at provincial levels, but also locally. And of course, youth and family engagement is really key to all of it. So how does this work at the community level? You know, first of all, this model really is predicated on intentional partnerships and effective partnerships. So people's inclination to collaborate is critically important in order for this to be successful, not just at a community level, but of course across the whole network and provincially. So what happens in a community is that the centers themselves are operated by an individual, local, typically not-for-profit organization. So whether that's determined by the community in terms of which organization might be best suited to lead that work, there's a process by which to identify that organization. And then that organization is responsible to convene other providers in the community. So those who are already providing some sort of service to young people, whether that's primary care, social services, including supported housing, you know, you name it. Those folks are all brought together, and you know, really a pretty comprehensive scan happens in terms of identifying all of the services that do exist and who is wanting to be a part of the integrated youth service center. In some communities, we've seen in British Columbia, we've seen smaller organizations actually move their entire organization into the center. It just, in terms of the value proposition for them, it made really good sense. But more often than not, what it looks like is service providers in the community coming in to spend a portion of their week in the center, so that, again, young people have just one door to walk into to get access to any number of services. So once the partnerships are brought together, thank you, Joanna. There's funding provided to fill gaps in service. So obviously we're not looking to be redundant in terms of services that exist, but we know that there are gaps, and so the funding helps to fill those. So, you know, and Joanna touched on this, but I don't think it can be stressed enough, the importance of engaging young people through integrated youth services generally. If we want to transform systems for young people, we need to understand from them what needs to look and feel and be different. And what we've seen in communities is that there really is an exciting sort of community of practice that gets built up. So whether it's peer support workers, so part of the model is that young people with lived or living experience can be employed as peer support workers. They're of course provided with some training and of course supervision and support. But you know what that helps to do is young people are able to see themselves and be seen as being experts in family and youth mental health, which of course they are. It's a really, I mean, there's a significant amount of evidence around how effective peer support is, and not only youth peer support, but we have family/caregiver peer support, with those people with lived or living experiences as well. And, you know, there's been some work done. This is getting a little bit dated now, but really there's significant evidence to suggest that through the engagement process, if young people are meaningfully engaged, they're less likely to report suicidal thoughts in spite of risk factors that they have. So this may seem like an obvious statement, but I think, again, and it's a learning curve for all of us as we try to continuously do this in a good way or in a meaningful way, but I think that we've made some significant strides. And again, family engagement. So not only is this, you know, these are centers built by and for young people, but of course we know, I think a significant gap in our services is support for families, at least in the public system. And so again, all the centers will have a youth advisory council, but also a family advisory council. So they're able to inform the leadership around what they want and need to see in these centers. So in addition to family/caregiver peer support, there's also family therapeutic support that's provided too. Again, you know, and it's of course up to the young person in terms of how engaged they want their families to be in their care, but we know that typically that's a really important piece as well. And then just quickly here, I know this is a bit of a messy slide, busy slide, I guess I should say. So I was with Foundry for 4 years before coming to Alberta. And, you know, we had a developmental evaluation. They still have a developmental evaluation going on, and it's brought to light a lot of very interesting data and information. So on the left is, you know, puzzle pieces, and I think we hear from young people and families a lot that currently they experience the systems as pretty broken and fragmented, and trying to access or navigate to care it can be a very challenging experience. And so Dr. Amy Salmon did a significant number of interviews through the developmental evaluation process. And, you know, initially about a year into the project, people were asked to describe what is Foundry. You know, what does it mean to you? What does it look like? What does it feel like? And, you know, after a significant amount of analysis, really, people were just simply describing it as, you know, these 5 core services. These are the core components, and they're kind of co-located, and we know that we can get access to those services. And then about a year and a half after that, Amy went back out and interviewed the same people around what they were starting to see Foundry develop into. And what she found, and her team found, is that really there was 4 main themes. This is really the transformation that I think Foundry and others are starting to be able to demonstrate. So Foundry's experience is a drop-in single point of access. In other words, no wrong door. Every door is the right door. No wrong time. No wait lists. I mean, certainly for more intensive services, people will be waiting, but there's a benchmark there, and it's not for very long. And while they're waiting, they're provided access to other services and supports. And there's integration just starting to happen there. It's a safe space, so young people describe it as a welcoming, safe place where they're able to explore options and tell their story. Privacy is protected, but young people are, you know, encouraged and supported to just be themselves. And back to Joanna's point earlier, you know, I had an interesting conversation with a young person out of Kelowna a couple years ago, and she said, you know, I don't necessarily know what's wrong with me when but I know that something is. And so often it's just about being able to talk that through and to help understand. No referrals. I mean, people do make referrals to Foundry or other integrated youth service centers, but I think one of the other transformational aspects is that people can walk in and they can, again, explore what might make sense for them in that moment, which could change over time and often does. And then I think something that we weren't necessarily expecting to see so strongly initially was just empowering young people as care seekers. So really, young people are meant to be supported to figure out what services that they want, and when, and by whom. And so I think, you know, if we talk about shifting trajectories for you know, healthy outcomes for young people in later life, teaching them or having them supported and empowered to actually seek out care is sort of a lifelong skill that's going to continue to be important. And that's it for that slide.
And I can show, maybe if people are interested, I will just show a picture of it so that people can have in their head what these sites actually look like. So I'll just grab one of our sites, and you kind of get to see a little bit. And it's also, this is a nice one, I think, because it demonstrates the collaboration across the various initiatives. So this is a Chatham-Kent site in Ontario, which initially started as an Access Open Minds site and is now transitioning into a Youth Wellness Hubs Ontario site. It was one of the things about it is that the location itself, young people were engaged in the identification of the location. Philanthropy was highly engaged in supporting a whole rebuild of the location. But philanthropy was also, and the community were also engaged in just some really interesting aspects of the site that helped to create the site as being belonging to the community and belonging to young people. So in the bottom, one of the bottom photos you see, what's on the wall there is the hood of a Ford truck, I think, or the hood of a truck anyway, is from the 1950s. And a local artist had taken that and has put on it, cutouts from media, newspapers from the time about, even at that time, having a hopeful vision about mental health, as well as some other things. It was created by a local artist and is there. For those of you who maybe typically work in the in a hospital sector or in other contexts, you can see that this does not look like a clinical space. This looks like it is very much a youth-friendly space. You know, you can pick up and throw these various pieces of furniture, which from a risk perspective, you know, makes the hospital kind of folks really, really anxious. But we have to balance the risk of not serving young people with the risk of these kinds of things. And then I'll lastly just say, well, I'll say two more things. This back room where it says free your mind on the wall, this back room is a place where young people can kind of, it's a bit of a cafe, hangout place. What you can't see is there's also a bank of computers where people can do their homework. And then in the upper side, that's just to say, you have a combination of big group spaces and where young people can hang out, and then you have individual interview rooms. So this is an individual therapy or interview room. Doesn't look at all, of course, like we would typically think of. This particular location, they have a series of, I think, 5, and they each have a different theme. There's a great video online if you wanted to go online and see it. And so this is the beach themed interview room. There's one that's Zen. There's one, I think, that's like pop art or pop, you know, and it has like album covers and different things. So, and each of those rooms was designed by young people. So you're really, you know, you're taking our current system and putting it on its head and really thinking through the lens of young people, co-creating with young people to create these spaces. So I'm going to stop there and get rid of the sharing. And I think Pam will open it up to discussion, comments, questions. Does that make sense?
Sure.
Excellent.
Yeah, thanks, guys. And maybe what we can do is that I think it would be a good interaction if you had a question, just maybe write it in the chat box, and then or just say I have a question, then I'll unmute you, and you can, if you're comfortable talking and showing your face, which most days I'm not, but if you are, that would be great. And if you're not, maybe just write a question in the chat, and I'll ask it on your behalf. So I'm going to give you a couple minutes, but maybe I'll ask a question first to get the ball rolling, you know, to stimulate some thought. Maybe Joanna and Pam, you guys could talk through how e-mental health interfaces with integrated youth services, both now and where you see it going in the future.
Pam, do you want to go first or do you want me to go first?
Go for it.
Okay, well, it's essential. So, you know, there's kind of like the physical space, and many of our hub initiatives have started out from a physical space perspective. So creating locations in communities that young people identify as being somewhere they can go. And with that physical location, we have the integration of all of these different services to provide that walk-in-based one-stop shop model of care. But many, many young people, for a variety of different reasons, may not be able to access a physical location. So that could be geography, it could be lack of transportation, it could be mobility issues, it could be issues around confidentiality and a young person's desire and need to reach out without having other people involved. And of course, it can be a pandemic as well. And so the need to be able to provide virtual services meets a need both in terms of replacing services that are typically provided in person, but it also gives us an opportunity to be innovative and to create services that reflect the experiences of young people. So, you know, since as long as I've been involved with this kind of work for, you know, more than a decade, throughout that time, youth have always flagged that we need to be more innovative and we need to, services need to reflect their ways of interacting with the world. And that includes technology as a very prominent piece of a way of connecting with other people, connecting with resources, tracking things, measuring things. So we really sort of have those two pieces. We have a way of allowing young people access to services, and we also have a way virtual services provides us with the impetus to really innovate and think about how do we start from a design perspective within the context of virtual services to create new kinds of services that might achieve even better and more effective outcomes for young people.
Yeah, that was a pretty comprehensive answer. I think like ditto. And right now, the functionality really is sort of video-based interactions, and also, of course, phone telehealth. And some providers are providing text-based support. Some providers are looking at, and of course, there's a plethora of existing, self-care apps already out there. And I think what needs to happen is some concerted effort to pull it all together and to provide a bit of a clearinghouse function so that we can also support young people to understand which of those apps are sort of evidence-based and which maybe aren't. But what I foresee for Alberta is hopefully, and we are having conversations about this right now, is building out chat-based support in addition to the sort of Zoom rooms that already exist, and people of course have been utilizing a lot through COVID-19.
Thank you for that. A couple, this is more of a request. Somebody wants to see the video of the mental health space mentioned at the end because they're looking for ideas to build their own space. So if you could share that, that would, if you have that available, that would be helpful.
I'll see if I can post it there.
Okay, that would be great.
I'll just add to that, sorry, that I know Foundry has been working on some virtual tours so that they'll be providing, if they haven't already, I can certainly share the link to the website, but they are doing that as well. So people can actually click in and take a virtual tour of a number of their centers.
Yeah, that would be really cool. Just can I follow on, and this is a little bit more granular of a question, and I see that we have Jeff Colomb in the Zoom room, and Jeff is on his second day as a director looking after young adults in Alberta Health Services, which is the formal healthcare system. But previous to that, Jeff was integral in helping build out what is called Connect Care in Alberta, which is, Jeff can speak to that in more detail. But as it pertains to e-mental health and electronic medical records, and specifically Connect Care in Alberta, I'm wondering, and this might be a question that Jeff could jump in on, because there's the interoperability between a Zoom room and then transferring that data into an electronic medical record is something that I don't think we've figured out yet, right? And due to COVID, AHS has decided, okay, Zoom is our platform of choice for whatever reason. And I'm not sure if there's that interoperability right now. Maybe Jeff's not even listening, but if he is, I'd love him to jump in and maybe answer that question or address that challenge.
And if I could just add to that, I'm curious whether Connect Care has been being built with an API attached to it to enable that interoperability, depending upon the other software.
I allowed you to talk, Jeff.
Are you able to hear me now?
Yeah.
Thanks, Mark, for the introduction and inviting me to speak. So indeed, I am listening and writing lots of notes. So thanks for the test. Appreciate that. But no, the Connect Care does it. In fact, actually hasn't integrated some of the Zoom capabilities right into Connect Care, so that a person is able to utilize what's called the patient portal, which is My AHS Connect, and it's a app-based mechanism for patients or clients to be able to actually integrate and interact with their chart, their provider teams through technology. So actually one of the initiatives that came out of COVID is that it really pushed AHS to look at how we can integrate Zoom right within the EMR. So if both parties have that application, obviously the clinician teams do, then the patients do as well. They can actually meet on Zoom, and it's really fully integrated within electronic medical record. I wouldn't say it's been highly used in AHS yet. I think people are finding that they're able to just use the normal Zoom mechanisms through the links, etc. But definitely lots of opportunity there regarding integrating Zoom and other technologies. We're really excited actually about how the patient portal can actually weave into a system of within Connect Care, so people can be more active partners in their care rather than this more being done to kind of model from the past.
That's all. Thanks so much, Jeff. I'm sorry to put you on the spot there, but you handled it admirably. I don't know if Pam or Joanna want to add on to that from their perspectives at all. Joanna, I'm not sure what your experience is in Ontario, but that might be interesting to unpack a little bit.
Yeah, I think there are a number of things going on in Ontario that, we're always trying to think of system transformation. So in Ontario, there's massive health system transformation going on right now across the health system in general, within the mental health system as well. And part of that is the development of an electronic and like virtual platform as part of system transformation. So we need to think about how we intersect with that. But one thing that Jeff made me think of is, I think one of the things we hear really consistently from young people and family members is the trauma that's caused by telling and retelling one's story, and the extent to which we can integrate these various pieces, leverage technology to ensure that young people tell their story once, and then have control over how that information gets shared across different service providers or different platforms, I think will be, really moving in the right direction. And I think, at some point we need to sort of really think about how we can partner across the country to move forward on some of this, because we don't want to replicate sort of like the history of silos in in-person care now as a future of silos in virtual care.
Yeah.
Yeah, it's great to hear about what's happening.
Yeah, it is exciting. And I would just add another complexity to that piece, which is, again, we're wanting to demonstrate impact. And so there's the evaluation component that's also data driven. So in terms of whatever mechanisms being used to capture that data, there's additionally the need to have that connect in with other EMRs or other, things.
So
I do see a question here, Mark.
I'll ask it to you, Pam. There's actually a couple questions.
Okay.
So the question is, and thanks for the answers around that to all three of you. That was really interesting. Question is, do the youth hubs employ their own workers, or are different organizations rotating through, taking turns as the dedicated hub workers? And so maybe Pam, you could address that question.
Sure. It's both. And so, yes, there's significant convening that happens with all the providers within that community to participate in the hub. And there is value for them to do that as well, because of course they get access to a number of other services for any young people or families that they would be supporting. So largely the staff who are the clinicians or physicians are from partner organizations, unless there's a gap identified. And so funds can be used to employ people that the lead agency would employ. So that could include mental health support, but typically it will definitely include, receptionists, medical office assistant, peer support workers, those services that don't sort of exist within the community. And, when I talked a little bit about the stepped care model, that's really the work that has to happen with all the partner organizations, so that folks are figuring out what the commitment is in terms of hours in the week or days in the week, and how they sort of support that step care model, including actually, which we haven't talked about, is walk-in counseling. But yeah, it's a combination of both.
Thanks, Pam.
Sorry, and just to finish that thought, I think really importantly, the integrated youth services movement or, you know, what's happening in different jurisdictions is really not meant to, like, the worst thing would be to create another kind of siloed model in an already fragmented system. So as much as possible, it is working with existing providers and just, you know, integrating that and supporting folks to figure out how to do that in the best way possible.
Thanks, Pam. Joanna, just a question for you. This is a comment, but I think there's a really important question within it. And the comment is just that I have 2 young adult children that were connected to service until they were 18. Sadly, the transition to adult services was not very successful. I hope Alberta can find success in transitioning youth. And so maybe, Joanna, you can just speak to that notion more broadly and how that's unfolded in Ontario. And Pam, you could also jump in from the BC context and what we hope to see in Alberta.
Sure. So the goal of the model is to, in an ideal model, we would say we would eliminate transitions. But realistically, really hubs are intended to meet most of the needs of most of the youth most of the time. And so for some youth, some of the time, transitions will still be rare. So of course, the first thing is our age range, 12 to 25. And even, I mean, I know outside of our jurisdiction, but I feel fairly confident it's probably the same. Those edges are soft. So we're really thinking through a developmental lens. So you're really thinking about where's the right place in the system for people who are in the edges of that age range. So already the hubs are spanning what has been a conventional sort of split in the system. Within the hubs, the services are designed with a developmental lens. So even though like most young people, or at least half of young people, do get lost between the adolescent and adult system, but even the ones that make it to the adult system, they're often not maintained and they don't get adequate service. And that's in part because the adult services aren't appropriate. So hubs really focus on ensuring we have developmentally appropriate services so that we, you know, we're able to meet the needs of young people. And then lastly, the model in Ontario, and I think models elsewhere as well, include a transition worker. So we have many protocols in place and plans in place. And sometimes there's slightly different roles, so care navigator or transition worker, but always having protocols. So where young people, all of their needs are not able to be met within the hub, if for whatever need they need to go outside of the hub, they always remain a young person, a member of the hub community for all of the other services. But say they need to go and get early psychosis services, and that might be sitting in a different organization, that someone within the hub walks that journey with that young person, and that they continue to stay connected to the hub so that they could still get employment services or they could still get other kinds of services, and someone is dedicated. So we really try to, I would say those are probably the active ingredients in terms of decreasing the negative impacts of transitions that have typically occurred in our system. The last thing I would say is we have really been advocating to government, and we have seen shifts in the Ontario government around making some systemic changes that will help to alleviate that as well by making sure that services are funded, you know, start to think about funding models across those different services and having them overseen by the same body of people. Pam, yeah.
Well, and I mean, yeah, there's transitions, lots of transitions, as you said. So young people transitioning out of the care of government, young people transitioning out of, you know, hospital. And I think the other piece that, like, quite intentionally, the idea through integrated youth services is to ensure that there's connections for all of those things, and that folks are talking with one another so that the information is shared and young people are supported as they transition. That's, you know, like if they need a more acute service, like, or even early psychosis intervention, yeah, it's that warm handoff that's really critical. And then hand it back as needed or appropriate.
Thanks, guys.
Sorry, I got some music.
That's okay. It just adds to the flavor of the session. So we're coming up to time here, and you know, I guess just one last offer to folks on the call, if you had any questions for Joanna or Pam, and just want to say that there are no stupid questions except for the ones that I ask. So if you are curious about something, by all means, I'll give you a few minutes. Oh, there we go. Oh, there we go. I just extracted a question. How can families help advocate for these changes? It's a great question.
I love that question. I've been sort of asking that question since arriving here too. And so, you know, I'll speak from an Alberta context. I do know that there's some work happening here. So within the Calgary region anyway, a family foundation is embarked on a process to speak with a number of young people and their families, caregivers, around what their experience has been, good or bad, but you know, mostly focused on what the challenges have been in terms of accessing care. So once that's sort of done, then I think we'll have, that'll be an important tool for us. You know, there's other family sort of organizations who are wanting to focus on youth mental health, and in particular IYS, through an organization called Imagine Alberta. And so connecting to them might be great. But, you know, I wouldn't mind following up with you offline too, just to talk that through a little bit more. And Joanna, I don't know if you have something you'd like to add.
In Ontario, we have, each community has, is supposed to have, and of course we're still in the process of development, but a local family advisory. And then at the provincial level, there's a provincial family advisory. I think family members can take care of themselves, do a lot of self-care, reach out for support, even if their young person isn't ready for support at sort of that very individual level. Get involved, you know, to the extent that you're comfortable, sort of the theme of this event, right? Breaking the silence, because I think when people start to talk, they find out that it's far more likely that the people who surround them also have experience with mental health concerns, and that by focusing collectively, we can have a larger collective impact. And then I think government does respond to hearing. And if we look at something like the autism sector, family members and caregivers have been very vocal in the autism sector and have really, I think, been able to get some momentum, and it would be great to have that. Families have been critical in the momentum we've seen in Canada, and family foundations. And so I would really encourage you, reach out to Pam, connect with Pam, and reach out to others. And I think people find it rewarding as well.
Yeah, just to reiterate that, I don't think it can be understated. What we saw in British Columbia through an organization started by a mom who is challenged to get care for her child, has grown into a pretty significant organization, and just the needle in terms of how far it's moved through Family Voices, yeah, it's critical, and it resonates for decision makers.
Thanks, guys. And I think I'll just wrap it up here. We have another webinar at 11, and somehow we can't do 2 Zoom rooms at once. So there's some technical issues, so I have to get off of here before 11. But I would just close by just saying thank you very much to Joanna and Pam. I think this was personally something that I was very interested in learning more about, and I'm sure everybody else was as well. But to the point about affecting change more broadly around what we're trying to do with this initiative is create spaces for conversation, shared understanding and learning, and challenge each other in a way that elevates the conversation both locally, provincially, and nationally. And what happened as a story just yesterday is that somebody who's going to be doing a webinar with this initiative reached out, and he's a parent of an adult with a severe mental illness, and he's been advocating for certain changes to the Mental Health Act for a long time. And because, thanks in large part to all you folks and the other 1,000 people and all the people on social media, this initiative has really garnered a lot of attention. And as a result, that individual now has a meeting with the Minister of Health and the Associate Minister of Addiction and Mental Health in 3 weeks' time. And he's been trying to meet with them for, 6 to 9 months. And so, don't underestimate your ability as an individual to affect change in a very significant way. And so I'll just end on that note. And I'll put in a plug as well for the other portion of this initiative is that we're really encouraging folks to get out for a walk or a jog or some exercise, and do that with family members or loved ones, because I think human connection, physical activity, and mental health are so interconnected, and that I think as a result of COVID that, you know, we've gained an appreciation for that. And so I encourage you all to get out and obviously practice the proper conventions of your jurisdiction with respect to COVID, but that's part of what we're trying to do here as well. So thank you very much, everybody, and have a great day.
Thanks,
Thank you.
everyone.
Thanks, Joanna. Thanks, everybody.